Hello and welcome to the ACC channel. Today I will be talking to you about the Mediterranean diet. This diet has been shown in studies to lower the risk of cardiovascular events. The diet became of interest when researchers found in the 1960s that people who lived in Mediterranean countries appeared to have a lower cardiovascular mortality. Their research led to two major studies which showed that both in primary and secondary prevention, the Mediterranean diet was useful in reducing cardiovascular events and stroke. The Mediterranean diet consists of a daily intake of vegetables, fruits, whole grain cereals, and healthy fats. On a weekly basis, you can consume fish, poultry, eggs, and beans. On a moderate basis, you can consume dairy products such as low-fat yogurt or cheeses. The intake of red meat should be limited. You can consume red wine occasionally with your meals. 7 to 10 daily servings of vegetables will be a cornerstone of the Mediterranean diet. Whole grains, such as whole grain bread, whole grain pasta, and cereals will also be a good addition. Another good choice is use of olive oil in place of butter. The nuts will be an essential part of this diet, including walnuts and almonds. Another important thing to add to the Mediterranean diet is fish, such as salmon, which contain a large amount of omega-3 fatty acids, which can help to lower the triglycerides, reduce blood clotting, and reduce the risk of cardiac and vascular events. A number of major studies involving the Mediterranean diet have been done, showing the reduction in cardiovascular events. Two of the major studies are the PREDI-MED study and the Lyon Heart Diet study. The PREDI-MED study was a primary prevention study looking at patients who had multiple risk factors for heart and vascular disease, including diabetes, high blood pressure, and high cholesterol. These patients were divided into three groups. One group was the control group. Another group followed the Mediterranean diet with nuts added to the diet, while a third group took the Mediterranean diet with extra virgin olive oil. They found that there was a significant reduction in major adverse cardiovascular events, including the prevention or significant reduction in the primary endpoint of death from cardiovascular causes, stroke, and heart attack. The Mediterranean diet was also shown to reduce the risk of developing diabetes, reduction in the metabolic syndrome, and improvement in the cholesterol level and weight. Therefore, we feel that based on this study, the Mediterranean diet will significantly lower long-term cardiac events. If you want to see any more videos, make sure to subscribe to this channel and like this video. If you have any questions about the Mediterranean diet, please leave a comment and I will try to answer your question.